Hi, my name is Katie Christl, nurse clinician with the Minneapolis Heart Institute. Thank you to the Marfan Foundation for allowing us to share this information with you and be part of this project. Minneapolis Heart Institute, part of Allina Health, is a tertiary hospital located in Minneapolis, Minnesota, serving our community throughout the upper Midwest by providing exceptional care as we prevent illness, restore health, and provide comfort to all who entrust us with their care. We'll start here by looking at the process for rapid transfer of a patient coming from an outside facility to ours who's experiencing a dissection. On confirmation or suspicion of an acute aortic dissection, one phone call to our access center begins activation of the protocol. A conference call connects the referring provider with members of our cardiology group and both cardiac and vascular surgery, allowing for discussion about patient status and review of initial imaging if available. Upon acceptance, decision is made for transport directly to our OR or to stop and stabilize in our emergency department, where additional images may be obtained if unavailable or inconclusive from the sending facility. For all acute dissections, transportation is arranged via the fastest route possible. Communication is maintained between the transport crew and our facility to provide not only an estimated time of arrival, but continual updates so we can make sure that we're prepared prior to the patient arriving to our facility. There are several things that we have found that strengthen positive outcomes for our patients. One, in an effort to avoid delays in acute aortic dissection recognition and optimal management, we developed a standardized protocol for treatment seen here, with the goal that this would assist in providing consistent, integrated, and coordinated care for these patients who experience a dissection. This is readily available on both our Minneapolis Heart Institute website and on our mobile app. This is also frequently shared with our outreach partners. In confirmed aortic dissection, there is recommended medications to be administered to achieve desired parameters for both blood pressure and heart rate. Initial images should be obtained without contrast to exclude intramural hematoma, followed by a contrast CT of the chest and abdomen. These images are transmitted to our tertiary center whenever possible. Once the patient arrives at our institution, cardiology works closely with the surgical team to coordinate patient care, including involving appropriate subspecialties such as radiology, our emergency and critical care providers, in addition to managing anti-impulse therapy. This here is our mobile app. It has cardiovascular emergency protocols, including those involving the aorta, along with additional non-emergent and other clinical resources. In 2015, consensus at our institution was reached to embrace a comprehensive surgical approach for patients with type A dissection, especially in younger patients, those with connective tissue disorders, and those with multiple tears in the aortic arch. As part of this initiative, vascular surgery is now involved in the care of all patients with acute type A dissection, allowing collaborative review of the preoperative imaging to guide surgical management. In addition, guidelines were developed for the treatment of acute type B dissection, including thoracic endovascular aorta repair for asymptomatic patients exhibiting high-risk characteristics. This allows a modern approach to therapies and allows us to deliver the most up-to-date care. Additional items that we contribute to our positive outcomes is we strive to improve both short and long-term goals for our patients following an acute dissection. Therefore, our program strongly encourages patients to follow up at recommended intervals at months 3, 6, and 12, and annually thereafter for clinical and aortic imaging. At discharge, all patients are scheduled for that initial visit at 3 months with an aortic center physician, so either cardiologist, vascular surgeon, or cardiac surgeon, depending on that initial diagnosis and treatment. We recognize the importance of this first visit as it appears to reinforce successfully with the patient and family regarding the importance of those subsequent follow-ups, as we were able to demonstrate that in the research that you see here. Additionally, we recognize that similar patients that were highly compliant had significantly lower long-term mortality in comparison to those with low compliance. Since the inception of our aortic dissection program in 2005, many members of our staff had had the opportunity to participate in many educational aortic dissection talks and continuing educational conferences. In addition, we use medical simulation as a wonderful training tool offered to our emergency departments and regional medical transport bases as a way to ensure our protocols and guidelines reach these audiences for continued process improvement. Lastly, we hold a monthly aortic conference that discusses cases with the goal to improve care for our patients with both acute and chronic aortic conditions through multidisciplinary collaboration. And all of this is something that we absolutely contribute to our positive outcomes for our center. Thank you.